Every day in India, men and women in their 30s are brought to emergency rooms with massive heart attacks. Many of them had busy office jobs and no major medical history. In the days before the event, they only felt mild chest heaviness or unusual tiredness. Some of them blamed it on late nights work pressure or acidity. They told themselves that this is normal life. Then suddenly one evening the pain became severe and the family had only minutes to act. Some reach the hospital in time, some do not. If you are living on constant stress and you feel that your body will adjust on its own, this video is a serious warning. The same stress that slowly damages your mind and sleep can set up a heart attack years before you expect it. I am Dr. Heartwise, and I work with patients whose lives changed in one night. In this video, I will show you how daily stress silently injures the heart of working adults in India, the danger signs that mean your heart is already under strain, and the simple steps that can lower your risk starting today. From the first minute, treat this as a personal consultation, not as background noise. Watch with full attention and keep a note ready. If you feel that this information already touches your life, stay till the end and share this video with one colleague or family member who also lives under heavy stress. In many cities across India, there is a pattern that repeats again and again. A man in his mid-30s collapses at home after a long day. A woman in her early 40s feels intense chest pressure while walking up a simple flight of stairs. Neighbors call an ambulance. The news spreads that a young person has suffered a heart attack. Friends are shocked and ask how this can happen at such a young age. When we look deeper, we see common threads: long office hours, night shifts, irregular meals, high intake of fast food, tea, coffee, and energy drinks. Very little movement, very little real rest. On top of this, there is constant mental pressure. Targets, deadlines, fear of job loss, family responsibilities, and digital distraction. The mind is always on even when the person lies in bed. The human heart and circulation system can handle short periods of pressure. They are not designed for a life where pressure never drops. Under chronic stress, the body stays in a state of alert. Stress hormones raise heart rate and blood pressure. Blood vessels become more tense and inflamed. The inner lining of the arteries becomes more vulnerable to deposits of fat and clotting material. Over time, narrow plaques form silently inside the arteries that supply the heart. There is no pain while these plaques grow. Routine days pass and the person feels that this lifestyle is under control. Inside the body, the risk is slowly rising. One highly stressful day or one intense argument can act like a spark. A fragile plaque can crack and a clot can form around it. The blood flow to part of the heart muscle is suddenly blocked. Within minutes, heart cells start to die. This is the medical picture behind many sudden heart attacks in young people. They are not sudden at all. They are the final step in a chain that began years earlier with unhandled stress. If you can see pieces of your own life in this story, do not ignore it. In the next part, I will explain how stress and lifestyle slowly change your numbers, such as blood pressure, sugar, and cholesterol, long before you feel sick. Understanding this chain gives you the power to break it. If you find this information useful, press like and save this video so that you can return to it later. Before a major heart attack, there are often years in which the body is sending softer signals. In this part, we connect daily stress, blood pressure, sugar, cholesterol, and the heart. You will see how small choices in food, movement, and sleep add up over time. When a person lives with constant stress, the nervous system and hormone system adjust to this new normal. Stress hormones stay slightly higher through the day. The heart beats a little faster. Blood pressure readings move upwards. Maybe they are not high enough to receive a diagnosis of hypertension, but they are no longer in the ideal range. Many people do not check these numbers for years and assume that no news means good news. At the same time, stress often leads to comfort eating, more oily and salty food, more sugar, and more late-night snacks. Physical movement goes down and weight goes up. This combination slowly raises blood sugar and cholesterol. Extra fat around the abdomen is especially harmful because it releases substances that increase inflammation in the arteries. Now the blood is thicker, the vessel wall is more irritated, and the force of each heartbeat is higher than it should be. This is the environment in which plaques grow. In clinic, we often see a similar pattern. A person comes for a check only after a friend or colleague has suffered a heart event. They feel mostly fine, but simple tests reveal a different picture.
Blood pressure in the high range. Fasting sugar and average sugar near or in the diabetic range. Cholesterol levels raised. If this combination is ignored, the risk of future heart attack is many times higher than in someone with healthy numbers. The dangerous part is that stress often keeps the mind too busy to pay attention. The person may feel that there is no time to walk, no time to cook healthier food, or no time to sleep earlier. In reality, these basic steps are easier than living with damaged heart muscle.
If you have not checked your blood pressure, sugar and cholesterol in the last 1 or 2 years, take this video as a reminder. Book basic tests within the next week and write your numbers down. If they are higher than the safe range, work with a qualified doctor to make a plan. If your numbers are still good, use that as motivation to protect them. If this message feels valuable, share the video with one friend and ask them to get their numbers checked with you. Now let us look at warning signs that your heart and circulation may already be under stress from your lifestyle. As you listen, count how many of these points match your life. 2 or more points mean it is time to change direction.
These are common warning patterns in people at higher risk of stress-related heart problems. You feel tired even after what should be a normal work day, and this happens most days of the week. You often feel a heavy or tight sensation in the chest or upper back during emotional stress or physical effort, and you dismiss it as gas or muscle strain. You notice that climbing stairs or walking uphill makes you more breathless than 1 or 2 years ago, even though your weight has not dropped. You sleep less than 6.5 hours on most nights, or your sleep is broken and unrefreshing. You rely on several cups of strong tea, coffee, or energy drinks to stay awake through the day. You sit for many hours at a stretch with almost no real physical activity. You have been told at least once that your blood pressure, sugar, or cholesterol are high, but you have not followed regular treatment or follow-up. Heart disease runs in your close family, and yet you have not built protective habits for yourself. Each of these factors adds weight to the load on your heart. When several are present together, the risk does not only add, it multiplies. The good news is that simple changes, started early, can bring this risk down. You do not need a perfect life. You need a steady shift in direction. A realistic protective plan for a busy working adult can look like this. Aim for at least 30 minutes of brisk walking or another form of moderate activity on most days of the week. Protect a fixed sleep window of 6.5 to 7.5 hours on most nights and keep screens away for some time before bed. Reduce intake of fried and fast food step by step and add more simple home-cooked meals, vegetables, fruit and water. Limit stimulants after the afternoon and avoid smoking and heavy alcohol intake. Schedule health checks at least once a year, or more often if you already have high numbers or strong family history. Use simple stress relief practices such as slow breathing, short pauses between tasks, and short walks in natural light to calm the nervous system. None of these steps is dramatic on its own. Together they change the environment inside your body. They lower blood pressure, improve sugar control, reduce inflammation, and support a more stable heart rhythm.
If 2 or more of the warning patterns in this part match your life, do not delay. Choose 1 or 2 changes from the plan and start them today. Use the comments to share which point matched you the most and which change you will begin with. Your experience can guide another viewer. If you want more clear guidance on stress relief, heart health, and brain health, subscribe to this channel so you do not miss the next lessons. You have now seen how daily stress, numbers on a test report, and small lifestyle choices connect to major heart events in young adults. This is not a distant story. It is the present reality in many Indian cities. If this video helped you understand your own risk, press like so that more people receive it in their recommendations. Share it with at least one person whose routine looks similar to yours. Use the comment section to tell us which heart or stress-related topic you would like to learn about in future videos. Subscribe and turn on notifications so that you stay with us as we build a healthier pattern for your heart and mind, one clear lesson at a time.